Myself, Manish Arora, faculty member, Department of Applied Art, Faculty of Visual Art, Banaras Hindu University. Welcome you all in this 3-month part-time certificate course under Spark Project, Ministry of Education, Fundamental of Social Design, in association with Michigan State University, USA, and Maryland Institute College of Art, MICA, Baltimore, USA. With me today, Abhimanyu Kulkarni ji. A very good profile for that. I'm just read about that. It's a short brief. In the role of studio director for Philips in India, Abhimanyu headed a multidisciplinary design team of 60 designers based out of Bangalore. His work spanned across healthcare and consumer lifestyle, as well as with Philips Research and Digital Accelerator. Prior to this, he was Philips Design's Hong Kong branch as senior design manager for global account of audio multimedia application for 7 years. Abhimanyu graduated from IDC IIT Mumbai and worked in advertising and furniture industry before joining Philips as a product designer. He was worked across multiple locations of Philips in Asia and Europe on a variety of projects and has a number of international design awards to his credits, including CES Innovation, ID, USA, Hong Kong Industries Award. In his spare time, Abhimanyu draws cartoons and writes screenplays. A screenplay written by him was the winner of NFDC National Script Competition in 2014. Very welcome, sir. Now I am handing over the session to you and please start your discussion and presentation.
One second, I think, Dr. Arora, because I need to share my presentation, I need to just quickly quit and come back because I just changed my
Sure.
system preferences. Yeah.
No problem.
Sorry.
Yeah, you are
Yeah.
new
Yeah.
now. Reconnect, sir.
Okay. All right. So, shall I start now? Am I visible and audible properly?
Yes, you are audible and visible. Please start your session.
Okay, thank you. Thanks so much, Dr. Arora, and also Dr. Ajanta Sen for kindly introducing me. I'm very happy to be here, sharing whatever little experience that I have in this domain. And what I'm going to talk today, maybe let me just quickly share my screen. Let me know if it is visible.
Yes, sir. It is visible right now.
Yeah. So basically, what I actually thought about talking to you is, we talk a lot about the corporate social responsibility, and of course, I'm by no means an expert in on the CSR initiatives and activities, but as a part of design function, I participated and I was responsible for certain activities that you can classify as socially responsible. So what I thought today is that maybe from a design perspective, I want to talk to you about what does it mean to be designing responsibly. And this is not just about being a designer, but what I mean is as an activity of design. So it doesn't matter whether you're a designer or an engineer or or an artist or an applied artist. You could be anyone, but how do you bring that kind of a responsibility in the way you work, also in the organization that you work for? So as Dr. Arora introduced me, I have worked almost in my entire career with Philips, which is a healthcare company. So just to quickly tell you a little bit about Philips is that of course it's a multinational company from Holland, and it's predominantly present in the healthcare domain, but also in the consumer space. So it's kind of like it's looking at the entire health continuum from addressing living well to actually, sort of like doing serious healthcare work inside the hospitals, etc. So, it kind of like covers the entire continuum from sort of well-being to getting treated inside a hospital, etc. And we've had some interesting opportunities inside Philips to be socially responsible in the way we design. But maybe let me just flash this as a general guidance in terms of how Philips looked at social responsibility, and which I think applies also to any other company, whether big or small, is that today, if you look at our environment, what we call as our stakeholders, so for every company there are investors, who are interested, of course, in the long term sustainability of a company. Also what is the kind of impact this company is having on the society and actually also on the planet. Then, of course, if you are involved in kind of like consumer space where you are working with retailers to sell your products, as you know, a number of retailers themselves are actually looking at sustainability because they themselves are very much aware of the kind of wastage that goes into products, whether through you can say throwaway mentality or through packaging or service, etc., etc. Then, if you are a large company that works with business customers, so for instance, like Philips works with a lot of large hospitals. Now, these large hospitals we can call as customers, but a company could be working with other customers, like in a B2B space, as we call it, business to business. And so today, customers are also increasingly asking the companies, the organizations, their suppliers, to become more socially responsible, to become more sustainable. And of course, then coming to the consumers, the last is that, last but not the least, is that the entire society is now becoming much more educated, much more aware of our environment. We all talk about the increasing levels of pollution, the wastage that happens all around us. And we all want to actually live better. We want to live a better world for our children and for our future generations. So which also leads to, because the consumers are basically nothing but also our employees. If you look at it from an organization's perspective, they're also our employees. So today, more and more what we see, and I have been with Philips for a very long time, so I have seen that change, a very dramatic change, is that when I started to work in a company, it was more sort of like the mentality of, going to a factory and, just putting your head down and working for 8 hours. But today, if you look at an employee, the employees are today much more aware of what is going on around them. They want to really contribute positively, and that's a great thing because they today, because of internet, they are also aware of a lot of things, and which is also very great thing both from consumers' perspective as well as from employees, because now we can ask them to also take a little bit of responsibility. So it's not just only up to the company to do good, but it's actually the entire ecosystem together to do good for the society. Yeah. So I want to talk to you about like what I think is like maybe there are more levels to it, but like three levels of what I think is the socially responsible design. One is at the level of organization. So if you talk about a company within its society, its role within society, a company can do a lot in terms of being socially responsible. Then once you enter that company, and if you look at the way it goes about doing its work in terms of how it designs its product, how it manufactures its product, how it packages it, how it transports it, etc., how it conducts itself in short, there is a lot of social responsibility that we can bring in, the awareness and the actual, we can make a big difference in a way, organization contributes to society. And the third thing is, of course, then we are talking about like the society, the company, and then we are going down to an individual employee. And then we can say that, yes, as I was saying, an individual employee can also make a big difference in a way, to the society that we are in, because today people are very much aware and they want to contribute. And I'll show you an example of what we did in Philips to do this. So before I go on, I thought I will just talk about two, three useful design terms and tools. So because I don't know who is the actually who all are there in the audience, but in case you are not a designer, you haven't studied design, maybe here are some great terms and tools that you can get familiarized with, because I think they're useful not just to designers but to anyone. And I think the first and foremost, to me, the most critical tool that designers use, and I think everybody can really benefit from using, is the tool of journey mapping. What does journey mapping mean? In simple terms, is that our life is not static. We talk about our target customers, our consumers, etc., right? And we say that, okay, it's a middle-aged person. Like if you're talking about, let's say, our product that allows you to do shaving, for instance, or do electrical brushing of your teeth. We talk about a particular target segment. But what journey map actually does is that it takes that target segment and it kind of like thinks about them in the continuous kind of like almost their life, going through their life. So we talk about, in Philips, we talk about our consumers, going through their life. We talk about our patients going through their life. We talk about doctors going through their life. And one can do journey map for anything, any activity in life. You can do a journey map, whether you're putting up a project, whether you're thinking about your users using a product, or whether you're thinking about, creating an experience of people, let's say, going to a mall, for instance, like I'm in Bangalore now, and like this week the malls are open. So if I was working, let's say, for an organization that does the administrative things for a mall, I would think about a journey map of, let's say, a visitor to a mall. How do I create a safe environment for somebody who wanted to visit mall, but not get maybe infected by COVID, etc. So for everything basically in life, you can actually think about a journey map, or what we call in Philips also as an experience flow. They're all similar things. Of course, there are slight differences to them. When we talk about experience flow, we are talking about pains or gains of the expect that our users expect. Then there is something called as the service blueprint. For instance, if you think about, let's say, any experience that whether you go to the hospital, whether you go to a cinema hall, whether you go to McDonald's, all of that is service. Even if there are some products involved there, it's predominantly a service experience. And how do you create a great service experience for your users? So that's what is called a service blueprint. But the backbone of service blueprint again is a journey map, where we think about the stages, the activities that our end users do, and then we think about what are their challenges while going through that journey. So this is a very useful tool. I think one should be aware of. The second one is the stakeholder map. The stakeholder map is nothing but it shows, if you're thinking about a product or if you're thinking about a service, it's not that, we are in isolation. It's not like if Philips is making a product and selling it to its users, it's not just that like on the whole planet, there's only Philips and its users. We coexist with a lot of other, players. So if we talk about, again, healthcare, there is an insurance company, there is a regulator, there is a doctor, there is a nurse, there is an administrator, there is a IT person, there is patient's family, etc., etc. So you have a number of these stakeholders, and these stakeholders have kind of different relationships with each other. And these relationships also influence in a way we deliver our the experience to our end users, yeah, and also the way we design our products. So it's also important for us to be aware of who are the stakeholders in whatever we do, and what are their relationships with each other. And then the last one is, of course, design thinking. Again, I know many of you perhaps have practiced design thinking, or definitely are aware of the term. What design thinking in short means is that bringing people of different backgrounds, of different skills, of different viewpoints together, and get them to think about the problem. First, you get them to think about the problem, then get them to actually kind of like frame the challenge that we have, by going through these journey maps and stakeholder analysis, etc., and then get them to think about the solution. One is through ideation, and then second is by imagining, once we come up with this solution, how will that solution be used by our end users? Yeah. So some people call it double diamond process. There are various names for it. We in Philips, we used to call it co-create process. But design thinking is something that is the most common term that is used for it. But it's a four-step process in which you basically look at the problem, you try to understand the problem from different perspectives, then you try to frame what the problem is, so that everybody is on the same page as far as the understanding of the problem is concerned. And then you go about solving that problem, but again, involving all different viewpoints while you're still solving that problem. Because it's also possible, many times we have seen that, if a solution is found from a certain viewpoint. And if you have only certain viewpoints which are designing that solution, there is always a challenge, because as we saw that there are a number of different stakeholders who are involved in using that product or using that service, and it needs to address all of us. So these are some of the useful design terms and tools. Of course, I'm sure you know about them, or if you don't know about them, it might be worth just Googling them and finding out a little more about them, because they are really useful tools for anyone. Now, as I was saying, basically, I want to talk about these three levels of the, being socially responsible. And the first level, at the very highest level, I think is the level where I want to talk about what can an organization do within the society that it exists in. And again, I'm going to take an example of Philips, but of course, one could be working for any company, and but you can apply the same kind of like a design thinking process to any organization. But I'm going to take the example of healthcare because I come from Philips. Now, as you know, healthcare again is a very big challenge. It's one of those wicked problems, not just in India but around the world. Yeah, and one of the why is it a wicked problem? Is because, as you know, the population of the world is expanding. Yeah, at the same time, if you look at it in a very simplistic way, the number of doctors and the number of resources that we have in the world are very limited. So even if you talk about advanced countries like in the Western hemisphere, of course, the healthcare infrastructure there is far better than, let's say, Africa or Asia. But even there, you have lots of pockets, even in US, where you don't have access to good healthcare. Because we always, when we think about America, we always think about, the Bay Area or New York and, cities like that. But there are a lot of places where, the doctors are not easily accessible. And then you come to places like India, Bangladesh, etc. And then you talk about Africa. You will see vast differences in terms of who has access to care. How much do you have to pay for that access to care? What is the quality of care that you get, etc. And companies like Philips are very much aware and concerned about this. So it's not like it's just about selling products to the people who can afford it. That is in the Western countries. But in fact, actually, Philips's mission is about providing 2.5 billion people, access to good healthcare by the year 2030. And you can only do that by bringing in more and more sections of the society who don't have access to good healthcare. Yeah. So this is one of the programs that I've been associated with, and I want to just give you one example of. I mean, within access to care. So it's a big program that runs within Philips, and there are multiple projects that are happening within that. But I'll just give you one example of how does one go about, thinking about this. And here what we did was that we looked at Ayushman Bharat as the one vehicle that we wanted to actually latch on to. Because as you know, Ayushman Bharat is the Indian government's scheme to provide universal healthcare. Yeah. And there have been some phenomenal work that has been done within Ayushman Bharat initiative. And it'll just take too long to talk about the whole thing because the way it has been deployed now across different states, and of course, India being a big country, and the development within of healthcare within different states also differs, across India. So you have different states at different levels. Some states, for instance, in South India, have already pretty good state level healthcare infrastructure, whereas some states don't have it. But the idea is to eventually provide a kind of like a baseline healthcare infrastructure to all the states in India, and to provide also fair pricing for many of the things that people today feel, that there is too much of differential pricing, maybe between government and private sectors, or even within the private sector. If you go to one hospital versus the next hospital, you have no way of actually evaluating, what is fair price, etc. So the idea here is to basically provide a guidance also to the patients or to the population at large, in terms of how does one go about doing certain treatments, etc. But within Ayushman Bharat, if you're interested, there is a fantastic wealth of information that has already been created. And what we did within Philips was, this is just one of the exercises I want to show you, is that there are 13 different health spaces that Indian government has identified. So what we did was that we looked at these spaces, like, for instance, there is care in pregnancy and childbirth. There is neonatal health. Then there is childhood and adolescent healthcare services. Then there's family planning. Then management of communicable diseases, etc. So there are different spaces that have been, identified. So what we did within Philips was that we got a few people um, within Philips, of course, all the decision makers, but we also got an external NGO involved in it. And as you can see on the left-hand side wall here, um, we created this journey map. So if you are a person, looking at these 13 different health spaces, then going from the stages of awareness, for instance, like if you talk about cancer, oncology, space of oncology, if you have to create awareness within people about tobacco, for instance, or smoking or chewing pan, etc. So it starts there. But how do you go about then doing prevention? Then how do you go about creating, just registration for people? Just creating an awareness and getting people to come forward and kind of register themselves for a service. Then how do you screen different populations, etc., etc. So if you look at this journey map, what you see here on the wall is that different stages of the health journey of our patients. And what we did was that from our perspective, so from Philips' perspective, as well as from the NGO's perspective, government's perspective, we called out different pain points that we have today. What are the challenges today that we see in these spaces? And we recorded them on this wall here. As you can see, all these yellow post-its and different colored post-its that you see, these are actually the inputs given by all these different stakeholders that you see here. Yeah. And of course, just to give you, I know you can't read this, but just to give you an idea, the whole thing, at the end of it looked like this when we kind of like organized it nicely. Now, one of the main things, of course, when you think about a large project like this, because the thing with when you talk about an organization within society, and when you're talking about tackling a health space, let's say cardiac health, heart health. If you talk about heart health in India, as you know, India is the capital of heart diseases. India is also has a very large number of diabetic patients. We are also capital for diabetes in the whole world because our lifestyle is changing now. We are getting into this kind of like a sedentary lifestyle, and a lot of people actually today are suffering because of that. Yeah. So if we have to make an impact, we are talking about actually, recruiting and treating millions of people, and it's a project that is huge in its, scope. So when you talk about a project like that, you of course talk about project planning, so we would start with a journey map again of the project journey itself, like we did for the patient journey. Then we go into the project journey. And then, from an organization's perspective, we think about what is the kind of role that we want to play here. Do we want to be an orchestrator? Do we want to be a complementer? Or do we want to be an implementer? So, what does this mean? Orchestrator is that we want to do everything, like, we want to kind of like play. If you see an opera, the person who stands with the sticks in his hand, who controls or guides different players to, during a symphony. He's the orchestrator. So do we want to play that kind of a role? Do we want to take that kind of like an umbrella role? Or do we want to play just a complementer? So if somebody has got, let's say if there is a large hospital that wants to actually participate in that program, do we want to partner with that hospital and say, okay, we will partner with you, we'll provide you with technology, you provide us with your clinical knowledge or with your staff, and then together we can actually run this program? Or do we want to be just implementers, that we are none of these, and we just want to take the role of there are other strong players that are doing it, but we want to play a role of, that we will take what has been designed as the program and we'll kind of deploy it across the country, and all of these roles are very vital, they're very important. And of course, as an organization, there is a lot of engagement that would be needed through all of these. Now, if you look at, we talked also about the stakeholder analysis, so here also we did a lot of, very intense stakeholder analysis in terms of who could be our clinical partners, who could be orchestrators, who would want to play the orchestrator role, which are the states in India which have political will, for instance, who want to go in for that kind of like a large healthcare program, who should be our communication partner? Because if we want to create a program like that, we want to talk to people, we want to talk to government, about what we are doing. Who wants to be our technology partner? There is going to be a huge technological backbone that needs to be created for such a program. Who should be our technology partner? Of course, we are a technology company, but we are not the people who are into providing cloud services, for instance. Then do we want to, partner with companies like Microsoft or Amazon or things like that? So we have to think about who are the different stakeholders in this. And as you can see on the left hand side, then what we do is that what is it that each of these partners brings to the table? Do you bring in your clinical insights? Do you bring in data? Will you bring in different services like clinical services, IT services, etc.? Or do you bring in solutions? Or do you want to fund this project? Like say, for instance, like Bill Gates Foundation many times funds projects, right? So they're funding partners. So, we think about who could be our stakeholders, what could be the relationship between them, what would they expect from each other if they were to participate in this program? And then again, within healthcare, and it would change depending on the industry, is that we will start with a key performance index. How do we evaluate this project? How do we evaluate this program? If you're talking about heart health for India, how would we evaluate it? So here is one simple framework for it. We call it quadruple aim, where we are talking about improving patient experience, better health outcomes, lowering the cost of care, and improved clinicians experience. So basically all different players in it should be happy. And when we talk about what is the how do we actually get go from sort of this value for each of these stakeholders, how can we create an impact, then we sort of have to break down each of these quadruple aims that I talked about into smaller components, and then say, okay, which of these which we can actually create the value and which we can scale at the level of, let's say, a country. So I want to give an example of not Philips, but I just thought of bringing in Google's example. So Google has this program called Verily, which through simple retina scan analysis, it can predict actually cardiac risk. So look at, if we were to have Google Verily, in our rural area as a screening program to figure out who are the people who are actually likely cases of cardiac risk. It'll be very fast because all you're doing is you're scanning the retinas of people without getting into the complicated blood work and things like that. So when you talk about scale, we of course we look at projects like that, or our own product, which is a 24/7 remote ICU, Philips's product, where of course, because we don't have doctors in every village and the remotest areas, basically remote ICU helps you to create remote monitoring of the ICU. So you can have, let's say, a healthcare worker at a remote area, and an intensivist can sit at a district level or a town level and actually monitor multiple ICUs at the same time by using this system. So one could use system like that to actually implement a program like that. So just to give you a little bit of a glimpse of what I mean by playing for like a big program which is actually rolled out across the country. Yeah. Now the second example I want to give you is in the circular economy, and this is what I mean by the behavior of the organization. How do you go about actually behaving on a day-to-day basis, for when you talk about being socially responsible. Yeah. And at very high level again of Philips, we talk about different initiatives, at the level of hardware. We talk about how do we want to switch from hardware more to the service, how do we want to extend the life of the products, how do we want to slow down the loops of upgrades, etc., and how do we want people to use software products, to reduce the use of the hardware, minimize the use of the hardware. For instance, if you look at this product called as Lumify, if you're familiar with ultrasound machines, so Lumify actually has got a software which is on the cloud, and it can be downloaded to any tablet, and with the help of a simple basically a probe, you can convert any tablet into an ultrasound machine. Yeah. So what you're doing basically is that you're reducing a very complicated ultrasound machine into something which is commonly available. It's almost like you can use your own tablet. As long as you have a probe, you can start to use this as an ultrasound machine. But I just want to come down to a very simple example of something that we did for a brand that Philips owns called as Preeti, and this was a project that we did with NID students, where we talked to Preeti about so Preeti is a company that actually makes so it's based in Chennai, and it makes domestic goods like mixer grinders, juicers, and gas stoves, etc. And we wanted to seed the idea of circular economy in Preeti because they produce a lot of consumer products, which, of course, as you know, mixer grinder is a very basic product in every household, Indian household, and the kind of load that is put on a mixer grinder in an Indian household, of course, you constantly have service calls and you have breakdowns, etc., etc. So also the kind of packaging that is needed, so it's a company that is kind of like ripe for having circular economy mindset. So what we did was that we did this workshop with them. As you can see, we had a lot of stakeholders from Preeti in the room. And what we did was that we kind of like identified key themes for them. So we visited their suppliers, etc. And what we actually came up with, these themes that you see on the top are, how can we actually use recycled products? How can we refurbish their products? How can we extend their serviceable life? How can we use you more like a platform approach? And I'll talk about it in a minute, more about the platform approach. But how can we use more kind of like a modular construction so that the life of the products can be extended further. And how do we use the service model? And service model is something, of course, that has been now extensively used, not just in domestic. In fact, it's a little bit less in consumer products, but far more in the business to business kind of space. I'll tell you a couple of examples of that. So then we came up with what do we need to do in order to actually implement that within the environment of Preeti. Well, this is an output of the co-create workshop that we did on circular economy with Preeti. And as you can see, basically we went through again. I was talking about journey map. Here again, we were doing a journey map, but this time we were doing a journey map for the product in terms of how does it get conceived, how does it get designed, how does it get made in the suppliers' factories? How does it get assembled? How does it get transported? How does it go to the users? How do users use it? How do users give service calls? How does it get picked up from the users' homes, etc.? So again, you can see there is that entire journey, and during that journey, we look at a lot of different stages of this product that goes through, and of course the stages where, as you can already see, where we can help reduce the consumption of material, the consumption of fuels, etc., etc. Right. So this was a great example, I think, for us, because it was very sort of like a contained kind of workshop that we did, because Preeti is not that huge an organization. Now, I want to talk about a little bit. I'm just taking this reference from Ellen MacArthur's Foundation's map about what happens to from sort of like extracting the raw materials when you make the products to the part supply, then manufacturing, distribution, etc., and then it finally goes into the landfill. And what is it that can be done at each of these stages? And I'm just going to talk about a couple of these stages right now, given the time we have. So one of the exercises that we do, as you can see on the right hand side, is what we call as the product teardown exercise. So this you see here is our C-arm. It's something that is used for image guided therapy. But what product teardown exercise means is that you're looking at each and every component of a product as it is getting made, as it is getting designed, and you're thinking about how does this get recycled? Can we use an existing part from other product? What is the kind of material that we are using for this? Are we using paint here? Are we using any finishing processes here that are not sustainable, etc.? So basically, by splicing down your product into its most smallest part, basically you examine the product for its sustainability aspect. And because we are also involved in as you can see, a patient journey here below. So going from, if you talk about a cardiac event, like somebody gets a heart attack, so from that heart attack to recovery, that is what you see the journey map here. If you look at the kind of products that get used here, you can see here in the design studio, what is it that we do? So we look at also our own design process in terms of how do we go about designing conceiving these products, and how can we bring the aspect of sustainability within each of those. And because we are looking at the entire journey map, because we are looking at the entire portfolio of products for cardiac care, we can already start to think about how we can make things modular, how we can make a common platform where we are using common parts between different products, etc. So, and that's the benefit of doing this, and taking that kind of like a global view of the entire product portfolio. And just to again give you another example, we call this as the material trends studies. We also bring that thinking into every year we do a study of what is it that we know about materials today. What is it that is maturing in terms of the new technologies, new processes, etc. And where is it that we actually see the future? So if you look at this 2025 in the corner, where do we see the materials going? Where do we want the materials to go? If you talk about like one of the trends that is shown here is humanizing the materials, or embedding technologies in the materials. What does that mean? So is it like the materials themselves are become more sustainable, or the materials have some kind of a signal built into them, or sensors built into them to kind of like indicate or signal their useful life, etc. So one could start to brainstorm things like that during what we call as this trends workshop for the materials. And coming down to circular economy, again, I want to just give you a couple of other examples of what we call, if you talk about dematerializing, reducing, consumption of resources, and I just want to call your attention to this part here, which we call as a shift to value-based care and care shifting to lower cost settings and the home. Because now, if you look at for instance, the care that happens in the hospitals. If you actually happen to go to a hospital, you spend some time there, perhaps maybe not now, it's not maybe a good idea during COVID, but if you actually go to a hospital and observe it, there is a lot of wastage that happens in a hospital. Yeah, and one of the concerns for us has been that how do you reduce that wastage which comes through consumables? Yeah, and one way to do that, is by actually shifting that care to home. So, for instance, if you're talking about maintaining a room hygienically within a hospital, you can already imagine the kind of resources that are consumed, the human resources in terms of maintaining that room, the chemicals, etc. Just in kind of like maintaining the linens and the beddings and etc. etc. There's a lot of consumption that happens within a hospital. Not to talk about even the clinical consumption. But if you're at home, basically, a lot of it could just become part of basically caring for a patient at home. So by shifting that care to home, of course, there are also other benefits of why that shift is happening, because people recover faster when they are with their loved ones, with their families, etc. So there are also many reasons for that, but there's also a reason of sustainability which is associated with that. Another trend also I want to highlight here and I want to talk about quickly is on the increase of the platform base, what we call as creating platforms for sharing within product portfolio. So if you talk about shifting care to low cost settings, like, even in India, we've started a program called as Home Care program for our respiratory products, because these products are expensive, they're difficult to maintain at home. And if once they go through the end of life, it's also difficult for an individual consumer to dispose them off responsibly, etc. So what basically Philips has offered is that you can basically rent them or subscribe to these products. It's almost like you're paying per use for these products. And we are, of course, not alone, and this is not the only example of doing that. I just Googled and came up with this other example of what GE does, in its aircraft engines. So GE doesn't sell its engines to the airline companies. It sells them the flying hours. And what it does is that it basically installs, maintains, services, and guarantees the uptime for its engines. So which is a very different way of looking at the consumption than saying that, okay, if you look at the old times where if you had to consume something, you had to own it. So that the idea of the ownership basically is shifting to this kind of like pay-per-use. Now, I talked about platforms as the way to dematerialize, and here is a simple diagram that we use in Philips to kind of like show what has happened in digital transformation. We talk about going from analog to digital, then from single function to multiple functions, and then from multiple functions to system of systems. So if you look at the devices that were used for monitoring patients, so for instance, like blood pressure monitor, you see it here. That is the kind of size of the blood pressure monitor that used to be there back in maybe 50s. Or if you look at the body temperature and respiratory measurement, it used to be like that huge a product, and it was doing only single function. But if you look at today's patient monitors, they do all basic measurements. So all you need on the patient's body is a simple electrode, which is stuck on the patient's body at multiple, spots. And this single monitor has got everything that a doctor would need about that patient. All information is already there. Now, that is what we call as going from single function to multiple functions, and from multiple functions to a system. And then coming up next, which is already here, is this going from system to system of systems, where we are not only putting this patient monitor information on the cloud, but we are actually bringing together multiple sources of information, which are very complex, and then putting them together and using AI to give very intelligent clinical decision support to our doctors and nurses. And that's where you can say that there's a true dematerialization happening, because all you need is basically these simple electrode sensors on patients' bodies, and you can have 24/7 monitoring of the patients in irrespective of the context that they're in, whether they're at home or whether they're in the general ward, or whether they're in ICU, or they're in operation theater. Basically all of that comes together in the cloud, and then there is a processing by the AI to give intelligent insights to the attending clinicians. Yeah. And then lastly, I want to talk about the employees of the company, and I want to talk about one program that we ran in Philips called as Philanthropy by Design. And as we were saying, today consumers as well as our employees are looking for meaning. They're looking for purpose. They want an opportunity to contribute to the society. So one of the things what we have done in Philips is that we give 4 hours every week to our employees to do something that they want to do. So if you talk about a 40-hour week, out of that 4 hours every week, a person can spend that time either developing their own skills or getting together to learn about a new technology and develop let's say a prototype in AR VR or something like that. Or this was they can do something like this where which we call as philanthropy by design, because it's just you're contributing to society by just giving your time. It's not about really giving away money or anything like that. So this is what design can actually make a difference, because we have the way to look at the world. We are also creative to solve the problems of the world. So this was one of the projects that came out of the Philanthropy by Design initiative, Smokeless Chula, which became a very big initiative actually for Philips Design. And it came out of a simple global workshop that happened in Holland, where, of course, as you can see, a number of, I mean, all of the entire design studio from India also participated, and we took our problems there, and we got the entire design community to think about the problems, of the challenges of, the smoke, caused by the smoke in the houses, which, because most of the houses, if you go into rural areas, don't have proper ventilation, and especially in the kitchen. So if you look at the kitchens, they are very dark. There is, there's usually not cross windows, etc., to for the wind to blow. And for a long time, while cooking is being done, and because women are the ones that are mostly doing the cooking, it seriously affects their health. I mean, there's some serious statistical data I'm not able to recall at this moment, but women and children are the two sections that are affected most by the indoor smoke. And what we wanted to do was to create a solution which we wanted to give away for free, which could be created by people in the community itself. So what we did here was that in Philips Design, some designers got together. So Praveen Marigodi here is also an IDC, and he was the main designer for this. So we designed this chula, which actually can be made out of local materials. So, once we also identified people who could make molds for this. So you can buy molds from them and actually make chulas in wherever, whatever community, that the users are in. So here what you're seeing are a few pictures actually from near Alandi in near Pune, and also Bandipur in Karnataka, where it's a tribal area. Bandipur is a tribal area, and basically there was one person who decided to take that initiative and make chulas for people around, and that gave also an employment to this person. It provided like means of earning for them. So it was almost like an entire business model was created for them. We helped them with how to make chulas, how to install them, etc., etc. And we also monitored in terms of the results that they were getting, and whether it was indeed leading to smokeless kitchens. And I'm happy to say that we were very successful in implementing it in many places in India, but not just in India, because we won a lot of awards for this chula, and the chula design was also taken to places in Africa like Kenya, or in Latin America like Peru, etc., where we made some changes according to the context of cooking there. So for instance, in Latin America, people don't cook by squatting on the floor like we do here, but they stand up while cooking. So what we did was we kind of like we put these chulas on a platform, but basically the design of the chula remained the same, because the principle of the aerodynamics about for reducing the smoke, remain the same. So what you see here is a complete ecosystem that we designed. So what you see here is this self-help group, which kind of like put together the money, people who put together, and produced these chulas, people who implemented them, etc., and people who use them. And this was entirely done by by designers, by spending their own time under this program called Philanthropy Design. So that's all I wanted to talk to you about. I think it has been a long talk. Mm. And I just wanted to leave you with this thought that, I think to me, the principle of sustainability is really about asking why long before asking how. Sometimes whether we are designers or we are engineers, we are too keen to get cracking with making things, because we are so good in something, we really want to, make things, and, we want to sell things, etc. But it's always worth asking, why are we doing this? Long before us saying, how are we going to do this? Yeah. So thank you very much.
Thank you. Thank you very much, sir, for your very, very, very valuable inputs, and very good story of and your journey with lots of experience, experiments also for the healthcare industry, and for this is such a great organization like Philips. And I really congratulate to you also because you continuous working in a one company. That's another milestone achievement for any of the great artist or any personal. So on behalf of all of us, I'm very much thankful to you for your valuable
Thank you.
input. And a special thanks to Dr. Ajanta Sen ma'am to facilitate this type of session for us also. On behalf of Department of Applied Art, Faculty of Visual Art, Banaras Hindu University, Maryland Institute College of Art, MICA, and Michigan State University, USA, with the organizing team, I heartily thanks to you for your valuable inputs of today's lecture. Thank you, sir. We will surely
Thank you.
meet soon for any other program. Thank you, sir.
Thank you.